throughout most of the presentation today is providing a demonstration of the secure mail application, showing everyone how it works, how it acts and behaves, and how it can be of a benefit to your practice day in and day out. We have thousands of users around the world already, and I'm sure that what we'll be showing you today will be something that you'll be keen to get into your own practice as well. So what I'll do now at this point is bring on another speaker. I'd like to introduce Mr. Rohit Joshi, CEO of Bright Squid Dental, and he'll take over from this point, and you'll be hearing from me again in just a couple of minutes when we get into the live demonstration. Rohit?
Thanks, Mark. It's a pleasure to virtually meet all of you. We started Bright Squid Dental Link about 5 years ago now, and I've got a long history both in technology connected to the medical process and medical systems, as well as graduating with a degree in law. And when we chose to start the company, we really looked at what we considered to be a big challenge in dentistry. And that was that dentists typically need to share information either with their patients or with the lab or with their specialist. And the challenge that we saw coming and what we built for was the fact that that has to be done in a secure manner for HIPAA compliance purposes. So since those early days, we took a few years just to get the product created, launched the company about 2.5 years ago, and we're very proud to say now that we've got 6,000 users and growing rapidly. So we see at least 180 new users per week. We're managing about 55,000 patient records, and thousands of messages and files per week get sent through our system. Lots of testimonials from people that you may or may not recognize, but people that have been very faithful and great users of ours. And if you see at the bottom of the screen, if you do a quick search or just go to our website, you'll see lots that's been written about us. We're very excited about that. I think we've done a good thing and a noteworthy thing, and you'll see people carrying us quite a bit. So let's get down to the details now. So what we wanted to do today was talk about email in your practice and some of the HIPAA compliance requirements. Also wanted to touch on data breach and some of the fines that exist, and that really is from a HIPAA compliance perspective. Then of course we'll be talking to you about Secure Mail, which is the product that we've created to answer the challenges that exist for the dental community in sharing private information. And then we'll actually have a questions and answers session, and I'm pleased to say we already have a few questions, and so keep them coming. We'll answer those at the end. We'll try to make the structured part of the webinar reasonably short so that you can ask those questions. We've got a good chance to get through them. So let's first talk about patient privacy laws. You know, there's quite a bit of quite a few acronyms. There's an acronym HIPAA, HITECH, Omnibus, PIPEDA, and what you'll see in all of those is some degree of concern and regulation around how information is stored and shared. And of particular concern is private health information. And so what we'll go through over the next few slides is how with protected health information, what we're really looking at is any information which could identify that individual. And there's about 18 separate things, including the patient's name, patient address, but even such things like photographs or any type of even small elements of that patient file that might identify that individual. For our purposes, we've taken a pretty narrow view, a pretty strict view of that, and done everything we can to make sure that you're protected to the highest level. What tends to be pretty interesting, and this has changed over the 5 years that I've been speaking to groups about the legislation, about HIPAA legislation. 5 years ago, there wasn't so many breaches that were being reported. Well, that's changed dramatically, and you can go to the HHS.gov website and do your own searches around this. But basically what this chart is telling us that there's over 200,000 individuals now that have been affected through a HIPAA breach from a dental practice. And so it's not something now that's been regulated in large hospitals or anything. It's coming right down to the individual dental practice. Now, the most revealing part of that is that there's not really a HIPAA officer that's going to come and knock on your door, and they're not going to ask you for your records. While that might happen, I'll agree with most people here that that's the likelihood of that happening probably pretty small. In reality, where the breaches occur is right at the bottom of this chart. You can see that theft. So in cases where computers have been stolen, cell phones have been lost, email has been hacked, those are the areas that cause the HIPAA breach. A few months ago, if you go into our webinar series, you'll see a person who we did a webinar with who walked into their dental practice to find 5 of their office computers missing. That triggered the HIPAA breach because that information, once it was stolen, it wasn't encrypted, and it was available for whoever stole those computers. So theft and loss make up the majority of all of those cases, and those are pretty credible things to think of that happen to you and me that can happen to you and me. So let's talk about what happens when you do lose something. The definition of a breach is that there's protected health information, PHI, that compromises the security or privacy of the information. So if that breach occurs, here's what you have to provide. First of all, you have to notify every single individual that was in your practice. So some of those may have actually had information stolen, some of them may not have, but your duty is to let everyone know that there has been a breach. Typically that will be a paper-based letter. In addition to that, you have to tell the media. So you have to publish in a paper, and it has to be like a prominent media outlet, that there was a breach. You also have to file a notice to the secretary and notification to your business associates. So let's get to the issues today that we're going to talk about. Many of our users, before we talk to them and inform them about email, they believe that email is compliant. A little bit of a lesson here. The way email works is it bounces around from my computer to the receiving computer. And when it bounces around, it goes through many different servers on the internet. Typically these are called middleman servers. Unfortunately, because you don't own those servers and we don't own those servers, we cannot guarantee the security of that message from where it originated on my computer to where it's receiving on your computer. Now, that's the major problem that we need to address, and that's why we've got our secure mail product that we've come out with. The bigger challenge, though, is that encryption is not enough. So the way we fix this problem is what's called data encryption. The problem is that there's lots of data encryption tools, but that's not good enough. For HIPAA compliance, we also have to have procedures that address the final disposal of that information. We have to be clear about how long we're storing it. We have to be auditable to say if we deleted that information, how it was deleted, and it's all done with the knowledge of the practice that we're working with. Secondly, and this is in fact a bigger challenge, there has to be completely auditable. All information has to be completely auditable. Now what that means is if I'm sending you an email, in the background we have to be able to provide a log of the fact that I sent you an email, and in fact that there was some images that were attached. What were those images, and when was that email sent? All of that information has to be recorded, but it goes one step further. If you take that email and then forward it to one of your other colleagues, we need to be able to report on that, and that's all according to the regulations. You can imagine how difficult that becomes if it's a normal email system, because once you've received it, it becomes very difficult to track it after that. And then there's this third layer of security, which is around user verification, automatic log-offs, and etc. Now this is condensing over 500 pages of regulation, so I'm sure I've missed some bits and pieces. But overall, this is where the real challenge lies in coming up with the service. Now let's look at some of the systems that you're using now probably, and that are very well used in our environment. So if you're using Outlook or Apple Mail, there's a couple of things here that are important. First of all is, from a compliance perspective, it's unlikely that those are secured systems. Typically because they bounce around, just like I was explaining earlier. The second thing, and this is more of a convenience aspect of it, is a lot of the files that we saw being transmitted when we were doing our research can be very large files. It can be anything from high-res images taken with your digital cameras, or right up to a cone beam CT scan. And many times, whether it be the lab or the specialist, those files would bounce. And so when we created a service, we wanted to make sure that it was going to be large enough that we could attach a full cone beam CT scan to an email. Or let's say 10 high-resolution images, because that's what's required for that patient. So we built our service to accommodate that. Just going quickly through the list here, Gmail is an interesting one because Google actually reads your emails. And you can tell, just because that's their business model, that it's not compliant, because the rule of thumb here is only those people who need to read your email should be able to read your email when it contains protected health information. Well, Google reads all of them. Hotmail is the same way, and in fact, Dropbox. If you're a user of Dropbox to share cone beam CT scans, and I'll tell you, I've been in hundreds of practices that do that, it does not protect you from HIPAA compliance. In fact, if you go to the website for Dropbox, they state quite clearly that they do not have HIPAA certifications. And SkyDrive, which is now called OneDrive by Microsoft, is similar. It is not HIPAA compliant. What's interesting is again, as I've been traveling, I've met a lot of people who say, well, who's going to be interested in my, inpatient data anyways? Well, the fact is that there's lots of stuff that can get transferred. Everything which might seem pretty innocuous, like somebody's birth date, right through to credit card numbers, other pieces of protected health information, social security numbers, and so on. And on the black market right now, each medical record can fetch about $50, and that's in comparison to a stolen credit card on the black market, which is less than $1, because people can shut those down pretty quickly. Just a bit of math here, 2,000 patients could be worth $100,000 to whoever stole it, which means there's a big incentive. The bigger challenge, though, is as we've talked to practices that have been breached, is that there's a loss of reputation, and I'm sure all of you would understand that too. If you had to publish to a newspaper, if you had to contact every one of your patients, it really starts to undermine that relationship. I know that the webinar that we did in June with Angela Donovan, she mentions that in fact 6 months after the breach, they were still getting screamed at by patients, and she ultimately ended up leaving that practice because it was pretty debilitating. There are long-term ramifications on the practice's reputation. Patients can also sue for reputational damage, and there are some examples of those that are now sort of a part of what's happened in the U.S. Well, without delaying or talking about anything more, what I'd like to do is let's jump into, Mark, a demonstration of Secure Mail, and I'll turn it over to you, and then I'll come back.
Sure thing. Thanks very much, Rohit. So let me turn on my screen broadcast here. I think everyone's screen probably just went blank. So what I'm going to do is share my screen from a live point of view, and that should be coming up on everyone's side right now. Rohit, if it's not coming up, please do let me know. And so what I'm going to do is take the next 15 minutes or so and show you exactly how the BrightSquid Secure Mail system works. As Rohit mentioned, we have thousands of users around the world already that have been using Secure Mail within their practices to connect with their colleagues, connect with your patients, to share information in a timely fashion in a way that looks and feels and behaves a lot like traditional email. In fact, you'll hear me repeat that a couple of times throughout my demonstration, that it's a lot like regular email, and that's very deliberate on our part. So by now your screen should have all reloaded, and you should now be seeing what's on my screen, which is the Welcome to Bright Squid Dental Link login page. Now, login pages are login pages, but I do want to point out a couple of interesting things about our system before I actually log in. And first and foremost, what you'll notice is I'm logging into the Bright Squid Secure Mail system through my web browser. The Bright Squid application, Secure Mail application, as it were, is entirely web-based. So there's no software to download or install. There's nothing to maintain from an infrastructure point of view. Certainly no servers have to be installed in your back office or anything like that, because we handle all that and manage all that through our server system. You just log in through your web browser to get access to your account. And perhaps more importantly than all that, because we're web-based, it almost goes without saying, you can access your Secure Mail account from anywhere. You don't necessarily have to be at the specific computer in your office. You can use it from the front office, the back office, specific operatories within your practice, even if you're at home or on the road or using someone else's laptop. Much like you would log into your secure online banking site, you can also log into your Secure Mail account just by going to the login portal, entering your username and password, and accessing your information. So laptops, mobile devices like tablets and smartphones, any of those tools that have a web browser and of course are connected to the internet will permit you to connect and get access to your account. So with that said, from an infrastructure point of view, I'm going to go ahead and log myself in right now as a pretend doctor on the demonstration environment and log in and take a look at his Secure Mail inbox. So I've entered his username and password, and now I will log in. Once the screen reloads, and I apologize for the little bit of a delay on the screen broadcast this morning, once the screen is reloaded, you'll now be seeing what probably looks relatively familiar to most of you. This is my Secure Mail inbox, and as I've already alluded to, very deliberately this inbox looks a lot like a traditional email inbox. So over here to the right-hand side of my screen, I have my messages that I've received recently from a couple of different colleagues. Over on the left-hand side are the options to compose a new message, view my deleted messages, sent messages, and of course access my address book and so on to compose messages to my colleagues as well as my patients. You know, if we haven't already talked about that, one of the values of Secure Mail is that not only does it allow you to connect with your professional colleagues such as specialists or referring doctors or laboratories or radiologists, but we also employ a specific interface to communicate directly with your patients. So if patients are asking for a copy of a invoice or a receipt, or perhaps they need a copy of an x-ray that was taken in your practice a few weeks or a few months ago, you can use our Secure Mail system to communicate that information directly to the patient in such a way that, of course, is far more secure and private than traditional email would be. So let's take a look at how Secure Mail actually works. And Rohit talked a lot about how email is problematic from a security standpoint just because of the nature of email. You know, when email was designed about 30 years ago, it was never intended to be a secure system. It was actually built to be more concerned about robustness than actual security. And over the years, there have been some attempts to retrofit it, but just the nature of the hops, the way that regular email works, makes it very difficult, in fact, really impossible to make it completely secure. So let's take a look at a message here, and what you're going to see when I open up this message from my colleague Clara is the Secure Mail message that I've received has actually come into my Secure Mail inbox in two parts. And these two parts are significant because you'll notice the first part is titled Email Message. So this top part of the message here that I've now highlighted was delivered not only to my Secure Mail inbox, but it also came to my regular, old-fashioned, for lack of a better term, email inbox. The reason that's so significant is that I'm still getting notified the way that I always have. My iPhone or my BlackBerry or what have you will buzz, bing, or honk in my pocket, or I'll get a desktop notification from my email client if I'm at my PC, letting me know that I've received this secure message. And you'll notice in this example that Clara, who sent me this message, has just typed some generic information in here saying, help, I need this patient's data as soon as possible. They have an appointment this afternoon. You'll notice it's generic enough that it doesn't indicate any information about who the patient is or what the diagnosis or anything else that could be considered PHI. So again, this is just the notification. And this exact message is replicated over in my email account as well. Now, the lower part of this message, where I've got secure mail, let me just highlight that to draw your attention down there. This part of the message here is the secure portion of the message. And this part of the message is only available once you're logged into the secure portal. So by identifying myself with a username and a password, the system recognizes who I am and provides access to my inbox and ultimately the secure private part of the message. Then as you can see, this part of the message in blue includes the patient's name, references a surgical event that happened on the 28th of February, a lot of very specific PHI, or that protected health information we talked about earlier. And this is exactly the kind of information that definitely should not be sent through insecure methods, such as traditional email. So this all works somewhat automatically. So the end users don't have to do a lot of encryption or decryption. All of that happens through the application. So there's no implementation or setup or configuration of security keys and making things, setting things up. You just log into the account, send a message like you normally would, and the rest of it takes care of it through the service itself. Let me just back up a step here to my inbox again, and I want to show you another message that I have here in my inbox. And in this case, it's from a doctor that I work with, Dr. Pierre Frichard, a name that some of you may be familiar with. And Dr. Frichard has sent me a message with the subject line, Adam Abel-candidate. So let's have a look at this message. When we open this message, you'll notice we see the very similar two-part structure that we saw in Clara's message a few minutes ago. The top part of the message, again, is the email notification. Again, it's generic. I just think this patient's a good candidate for a certain procedure, and let me know what you think. So this is very much the notification that says in my regular email, hey, I've sent you something important, go take a look at it. Now in this example, the important part of the message, or the secure part of the message, if I may, is a little information about the patient. So he's 41 years old, he quit smoking, has some allergies, any other discussion around the patient's specific requirements or medical history absolutely have to be sent through a secure system. But in this example, not only do we have this text-based information, but I also have a number of attachments. And this is one of the benefits that Secure Mail provides above and beyond all of the security and the compliance and the encryption and auditability, above and beyond all that, it's also far more convenient to use Secure Mail to transmit these kinds of files. As I'm sure you're aware, diagnostic imagery such as high-resolution X-rays and photographs or CT scans can be very, very large. The last one that I saw, the last CT scan that I saw was about 340 megabytes. So sending that large of a file through traditional email, well, obviously it's discouraged because it includes patient information, but it's actually effectively impossible in most scenarios because just about every email service that I've ever seen is not going to accept a file any larger than about 20 megabytes. Some are a bit more and some are a bit less, but certainly a CT scan of 340 megabytes is not going to go through email. Generally what happens when you try to send a very large file through traditional email, either your system will reject it when you send it, or if your system is more robust but the recipient's is less robust, well then the message gets rejected on the recipient's end with a message like, this email inbox is full, we can't accept a file of this size. So what tends to happen in those examples is, well, say I have an aesthetic case that I'm working on and I need to send half a dozen or a dozen photographs to my lab technician for shade and shape and so on. Well, if those files, each of those images is 5, 6, 10 megabytes in some examples, what ends up happening is I have two options. I can either go through the effort of reducing the resolution of those photos, making them smaller so they'll fit into the requirements of email, or I can send the photos one email at a time. So then I wind up sending 12 photos or 12 emails in a row to my lab and saying, here's photo 1 of 12, here's 2 of 12, and so on. And that becomes such a bear to deal with from a inconvenience standpoint, not to mention the fact that every one of those emails is most likely a HIPAA violation. So with Secure Mail, we've built it so the attachments can be very, very large as 500 megabytes. And so far, that's been plenty for just about every example that we can come up with. Now, as you can imagine, or should expect, I suppose, each of these attachments can, of course, be downloaded to my local computer, either one at a time or all at once with this download feature over here at the top, or sorry, on the side. But in addition to the ability to download and manipulate the files and save them to my local computer, we've also built in the ability to view these files directly within the Secure Mail interface. And this is really valuable because, like I mentioned earlier, with a web-based application, there's a very good chance that I'm not in my office. For all intents and purposes, I may not even be on my own computer. If I'm on vacation somewhere and I need to use my wife's laptop to access some files, I wouldn't necessarily want to download patient information to my wife's laptop. But I can open up the viewer and I can look at the files directly within the web interface. And in this case, of course, I'm looking at some teeth that look relatively healthy, at least to my untrained eye. And I can zoom in and take a close look at the high-resolution file like so, and do whatever diagnosis or gather whatever data I might be interested in. One of the other benefits of our viewer, above and beyond just looking at the file as I'm doing right now, I can also annotate or mark up the image like so. So for example, I can draw an arrow to this discolored tooth on the patient's right and make a comment about, this looks bad, or whatever the appropriate comment would be. And what's great about this annotation system is when I mark up the image like so, the system of Secure Mail now notifies the person who sent me this image in the first place, and it'll say, Dr. So-and-so has made a comment on a file that you've shared with him. So now the original sender, if you remember our friend Dr. Fashard, is notified. He logs into his own Secure Mail account, and he can see my comments, my conversations, whatever it is I've tried to draw his attention to. So again, keeping in mind that privacy is sort of the baseline, the convenience of the collaboration and communication that we can do through Secure Mail is far more than you would get through regular email or Dropbox or those other systems that you might be familiar with. Now in this example so far we've looked at a photograph. From our point of view, an X-ray is another image, and it displays in pretty much the same way. We also allow, of course, the ability to transmit other file types. Typical office files like a Word document or a PDF or an Excel spreadsheet or a PowerPoint presentation. All of that stuff, of course, is transmitted as well. Those would, of course, be downloaded to my local computer so I can view them in whatever software would be appropriate, Microsoft Word or Adobe Acrobat, whatever the case may be. Now finally, the last thing that I want to show you before I get into the composition of a new message is we also have included a viewer that allows me to view and manipulate and look at images that are in 3 dimensions. So photos and X-rays are 2-dimensional images. Most people have the software on their computer to work with that kind of a file. But we've also built in the ability here to view, manipulate, and rotate these solid 3-dimensional images known as STL files. So I'm not sure how well this is going to translate through the screen broadcast, but I can now rotate this model, this virtual model of my patient's one quadrant here. I can remove the upper or the lower to have a close look at the various surfaces within this model. And all of this is happening entirely within my web browser. So I haven't had to go hunting around the internet to find any special software to allow me to view this 3-dimensional file. And we get a lot of attention for this particular part of our application, especially from laboratories and specialists that work with these kinds of files all the time. Whether it's oral surgery or orthodontics or what have you. Those kinds of practices are typically making or generating these 3-dimensional files. And it's certainly handy to those users to be able to share this information with a general dentist or someone else for approval, for design conversations, and so on. So by including the viewer, allowing everyone to have a look at these 3D files, they can get a lot more information than you would normally get just from looking at a two-dimensional rendering of the same quadrant. So up to this point, I've been the recipient of information, and I've received these messages from my various colleagues. So now let's take a look at how we compose or send a message to someone else. So keep in mind my email analogy from earlier on, and what I'm going to do is click on the Compose button. That's relatively straightforward, and I'll address the message to someone. To start with, we'll use our friend Dr. Fauchard, who sent me that message a few moments ago. So I'm going to type in the first couple letters of his email address. I could also type in his first name, his last name, his practice name. And what happens, as you can see, is the secure mail system recognizes that as being one of my colleagues and from the autocomplete, and it displays his profile information here. So there's his photo, his full name, even his practice information, which allows me to select him from a list of recipients. By including his profile data there, I know that I've got the right person. You know, I might know a half a dozen Pierres, and I wouldn't want to accidentally send patient records to the wrong one. So we display as much information as the recipient's profile will allow or contains, so we can select the right person. But you may be asking yourself, and most people do, well, I'm sure not everyone in the world uses secure mail just yet. Give us some more time. So how do we include people who have not used secure mail before? Well, if you'll remember our two-part structure to our messages, because we incorporate traditional email into our messages, we can actually send a secure mail message to any email account. Let me see here. Mine is mark@brightsquid.com. And if I add that person now, or add myself to the list of recipients, and you can see the difference between Dr. Fauchard's profile panel and my own. There's no additional information for me. There's a placeholder icon where my photo would be. There's no first name, last name, and no practice information. So that's indicating to me as the sender that Mark is going to have to register or will get an invitation to sign up and start using secure mail for the very first time when I send him this message. So now very quickly I can compose the rest of the message, and we'll say this is regarding John Doe. And then in the email message part of this, I would write, Dear Mark, here is all the information you need for our shared patient. Just click the link below to sign up or connect with me through secure mail, and then you can access all the information through their secure portal. I'm not going to type that right now. I'm not nearly that fast of a typist, but just to illustrate how that would work. And then, of course, down here, I could upload any or all of the files that I want to send to Mark or myself. It's getting kind of confusing at this point. So I would just click on this button, browse my computer, attach the files that I want to attach, and in just a couple of seconds I can now send that message off. And instantaneously when I send that message, an email is delivered to Mark's regular email inbox. He gets that invitation, clicks on a link, and goes through the connection process. Now the connection or the registration process is not a grand event. All we ask for the recipients to do is tell us their first and last name, some practice information, and they set their own password. The recipients do not have to provide any payment information to receive information from a subscriber, nor do they have to pay anything to reply to that subscriber or compose a new message to them. As long as the recipient is communicating with a subscribing secure mail user, they can send unlimited data back and forth and discuss as many different cases as they may see fit. So I'm noticing that I may have gone a little bit over time on the demonstration. I'm hoping that it generated some questions and some interest. So Rohit, if you don't mind, what I'm going to do now is switch the screen broadcast back over to you, and we'll continue on.
That sounds great, Mark.
All right, Rohit, you should be able to display your screen again. So I'm going to take a look here and see if any more questions have come up. Oh, we had a couple more come in.
Yeah, so I did see some more as well. So what I'll do, Mark, I think I've got about 4 or 5 more slides, and then maybe we can jump right into the question and answer period.
Great.
So one of the things that Mark didn't get a chance to demonstrate, but we wanted to make mention of it, is that we can include of course, colleagues, your labs, the specialists, and all the protected health information that goes back and forth. But we also can include your patients, because your patients might want some of their own information, or they may want to contact you. Now, one of the things we did before we designed this was we spoke to a lot of practices, and one common concern that we heard from the practice owner or the dentist was we don't want the patients necessarily to be able to contact the dentist themselves. Those really need to be routed to the front desk staff or someone else that we designate. And so that's how we built the product. So the way that the product works is when the patient is at your practice, you invite them, just like Mark showed with, by entering their email. When they receive that invitation, they can now contact the practice, but they can't actually contact anyone individually in the practice through that connection. And that was something that we wanted to maintain the privacy of the practice, the doctor, and other people in the system that you may not want to communicate directly with the patients or be at their beck and call. One of the questions we get asked quite a bit is, well, what types of information could we use secure mail for? So we've got a list of examples here. So with your patients, you might want to include protected health information in appointment reminders. Now, just to be clear, systems like Smile Reminder or Demand Force can be used to send appointment reminders, but all those systems can do is send the very basics of the date and the time of the appointment. It can't really send any information, or should not send any information, like remember to have a good breakfast, or try not to take your, or do not take your prescriptions before the procedures, or the details of the procedure itself. None of that information can be sent because that's considered protected health information. The next thing that we recommend is any sort of treatment follow-up information, and these can be, elements very specific to that patient about what they need to do to follow up, to manage their treatment once they get home. Patient referrals, treatment records. So if a patient comes in and wants their record, wants their images, you need to be able to provide them. That's actually written into the HIPAA laws now, and you have a short period of time to do that. Those can all be sent through secure mail. Treatment consultations, this is a really interesting one that we're starting to see more and more practices that want to send some sort of consultation, treatment consult, before a patient embarks in a large treatment. The patient will want to review that with their family or other people. That can all be sent now through the secure mail. Prescription information and, of course, payment information. A lot of patients, rather than taking a piece of paper at the end of their session which has all the invoice details or payment details on it, they can just get that sent to them through secure mail. Now, with your colleagues, quite a bit of that same list. If you want to send patient referrals, any lab requisitions, images, x-rays, any treatment consultations, allergies, prescriptions that you might want to send to a specialist before they show up, any radiology consultations, and any patient record transfers. All those can happen through secure mail. Now, with your subscription, we'll also help you show your patients that you care about their security. With all of the media that's going on today, and I think, in the past couple of weeks, what's happened with the Apple iCloud has again sort of brought this up, whether it be Target, the Apple iCloud, Walmart, or others. Anywhere where people start getting sensitivity to release of information, we want to help you tell your patients that they are using a secure product. And so all of this information is available for download from our site, which allows you to demonstrate to your patients. And in part of that package, we've got a tabletop poster, we've got invitation cards that can be sent, and even a patient privacy brochure, which sort of talks about your concerns and desires to ensure their compliance. Now, for all of the Dentamax people on the webinar today, we're offering a special. And typically our service costs $39.99 a month. But if you go to our website and you click on the payment portion of it, what you'll find is if you enter the code Dentamax, you'll see the reduced price of $31.99 a month. So a significant savings over our retail pricing, and we really welcome Dentamax as a valued partner of ours, and this is our way of showing our appreciation for that. The best way to do that is you can go directly to www.secure-mail.com, click on the Sign Up button, and then remember to enter your coupon code. When you do click on it, just click on the dentist subscription portion of it, click on monthly. It will say $39.99, and then you'll enter in the coupon code, and it'll be reduced at the time of billing. And Mark, that is my last slide. So I think we're doing reasonably well for time. We've got about, well, some time anyways to answer some questions.
That's right. So wrote while you're still on this slide and on this topic, how long is that Dentamax coupon code valid for?
Mark, that's a great question. Maybe that's something you can help me with because I've forgotten.
Okay, you know what I'm going to do is I'm going to ask you the first question while I quickly research how long that's valid for. So okay, I'll come back to that. I was hoping you had the answer, but I need to look it up.
Sure.
So a couple questions came in. The first one actually was very early on in the conversation today, and it was can reminder postcards for cleaning appointments or other reminders be sent through the mail anymore? And then also as part of that is what about using text message to send reminders to patients?
Sure. So it's interesting about appointment reminders. The HIPAA laws have actually carved out a special exception for appointment reminders. So yes, you can send a text, you can send an email, and you can even send a postcard. The challenge really is you have to be very careful about the information that's included. Now, in days gone by, you could include, we welcome you back for this particular treatment. Remember to take your medication. Those sort of things are not allowed. It must be very simple and very generic. We're reminding you about your treatment next Thursday at 2 p.m. And so I think while it's allowed, there's still quite a bit of care that has to be taken in the exact wording of what's being sent out. I'll let you keep looking. I've got another question here that came up. We have old plaster models that we'd like to dispose of. However, each one has a patient's name written in permanent marker on the bottom with a date. Can we throw these in the garbage, or should we grind off or redact the name before disposal? That's a great question. We've come across this a couple of times now. Sometimes there's also old radiographs that have some protected health information, maybe not even on the x-ray, but in the frame around the x-ray. Laws are pretty clear about this. You have to redact or destroy anything that has that patient protected health information on it. So patient name, the date of the treatment, all of those would identify a particular treatment for a particular patient. So they have to be disposed of separately, redacted, or, in this example, ground off. I've got another question here too. It says, is it okay to arrange referrals for patients with another provider, like a specialist, by giving the name, date of birth, address, insurance, etc., over the phone? Yes. If you're doing it over the phone, that's fine. I think that of course you want to make sure you're talking with the right practice. That goes without saying almost. But over the phone, exchanging that type of information is absolutely fine. I'm just seeing less and less of it happen in the practices. That's the end of the messages that I've got here, Mark.
Sure, that's great. So I did find some information out about the coupon code, and it is valid for the foreseeable future. So it's not going to expire in 30 or 90 days. It's going to be a perpetual discount available for the next little while. Now, and a couple of other questions came in while I was looking that up, all having to do with how the subscription model works. So let me try to address all of those in a quick spiel about how everything works. So the our subscription model that's on the screen right now is the month-to-month subscription. So like I said, that's $39.99 minus the discount. However, we also do offer an annual subscription, which is typically $399.99 per year. The same Dentamax code will discount that by $75 per year. So again, equal to an equal amount of discount level, I guess is what I'm saying. Now, the other question about subscriptions that came up is we have multiple users in our practice. How does secure mail work or address that? Well, that's a great question, something that I should have addressed in my actual presentation. The subscriptions that we have that we're displaying here are actually for 5 unique user accounts within your practice. So as a subscriber, you have a user account for a doctor or 2 doctors and 3 or 4 support staff, depending on your configuration. And it's actually very important that each user has their own unique account and login ID and password. For various HIPAA compliance reasons, one of the ones that Rohit wasn't able to get to because, as we mentioned, it is quite a dense document. When you are accessing and sharing patient data, the user who logs in and accesses that information must be logged and tracked. So if there's one shared account that everyone is using, then you can't necessarily track back to who accessed that information. So that's why we offer the 5 account subscription for an average practice. Now, of course, if you're a larger practice, just give us a call and we'll find a way to make it fit and go from there. And I think that covers those questions. Now, Rohit, a couple more questions have come in. One is, do you offer HIPAA compliancy? Do you want to talk a little bit about how we address that compliant stuff?
Sure, Mark. So just to be clear, we're not a HIPAA compliancy consultant. We wouldn't be able to come to your practice and offer that type of service. But with respect to our product, we are a HIPAA compliant product, and so many people have questions around us signing business associates agreements, and of course we would sign those as a part of our HIPAA compliance. We have, and I have specifically, before day one, before opening our doors, we went through the many documents that we needed to ensure that the product was developed with HIPAA compliance in mind. So it was developed with that as a base level requirement, and fortunately my background as a lawyer helped me stay awake during the 500th page. but yeah, so we are a HIPAA compliant product, and as might not have been entirely clear, we're encrypted, all of our data in rest, all of our data in motion. We're fully backed up. We're fully auditable. We have logs that can be audited by third parties if required, and all of the other requirements that are necessary.
Thanks, Rohit. A couple more questions. I'm going to take the next 2 here. The first one I think is actually addressed directly to me, which is, can you do a demo for my office? Yes, absolutely. If what I've shown you today is of interest and you'd like to share it with the rest of the people in your practice, the doctors, the other staff, and what have you, please, my contact information you should all have already. I'm mark@brightsquid.com. You can also call our office at 1-800-238-6503, and you can arrange a demonstration. We can schedule 20, 30 minutes, whatever will work for your practice, and I'm happy to run through a demonstration similar to what I showed today to everyone else in your office. Another question that came in is there a limit to the number of messages I can send through BrightSquid, or are there other storage limits? No, there is not. Using that $39.99 per month rate, or sort of the discounted Dentamax coupon code, you get unlimited data with that registration. So that way you're able to send as many files as you need, and you're not busy counting megabytes to make sure that you're not over your limit for the week or the month or what have you. So we'll cover that. And the same goes, and this is very interesting and quite important, is the people that are sending information back to you are also able to send unlimited files to your practice as well. So if you are requesting other practices to send you x-rays and photos or CT scans or what have you, they're able to do that without delay. Now, Ro, did you receive another question while I was just talking there? Or did I misread that?
I did receive one, yes. I've got a question. Is this the only HIPAA compliant email program? So this message just came to me. Well, I'd say yes and no. I think if you did a search, you would find some programs that are there that say that they are HIPAA compliant, which means that they encrypt their data. And so I think that there's a bit of a confusion in the marketplace. We see encryption as one element of being HIPAA compliant because we believe that we need to back up your data as well. Otherwise, the practice has to back up the data. We believe that we have to be responsible for logging all of the emails that are sent with protected health information. If we don't provide that, then the practice has to provide that. We believe that we have to have automated log-off, remote access, and a number of other elements. If we don't do that, the practice has to do that. So there are other systems that say that they are encrypted and ready for HIPAA, but what you really have to ask, and what I'd encourage you to do when you're doing your testing or when you're doing your selection, is make sure that they are actually doing about 10 or 15 other things other than data encryption. I'm sure there's other HIPAA email systems out there, but none I think that have taken our approach that we've come across, especially with dentistry. You know, with the built-in image viewers, built-in STL file viewing, we haven't come across another one that's taken dentistry so seriously, I guess.
Thanks, Rohit. And a couple others have come in now, again, in the HIPAA vein, which I'll pose to you is a photograph of a patient's teeth considered private information if it has no other identifying marks?
Great question. You know, it's a question of you know, how little is little enough, I think, really, Mark. There's been examples where if there's a famous person, their smile along with maybe some other feature like a mole or a scar, if that's visible, people would consider that protected health information, because with the mole or a scar or something else that could be taken in the visual image, people could identify that that was the individual. For many people, you know, just the mouth probably isn't. But I'll tell you where people get into trouble with that, and what I've seen is they'll take the picture of that person's mouth, and then they'll put the name in the body of the email. So now it's a connection, and that's where people don't stay compliant. Just sending an image with teeth may not be, but then how are you going to identify that, you know, unless you've got a code system or some other system by way of identifying that to the recipient. So it's a complicated maneuver to do it that way.
Yeah, it's a very good point, Rohit. So we have a couple more questions here, but I see that we've only got about 2 or 3 minutes left. So I'm just going to ask this last one, and then we'll just wrap up with some final remarks. Let me just pick a good one here. Let me see. Oh, sorry. So I asked that one already. Is it safe to put patients a CD or USB in your computer? So if a patient brings in their records, I suppose, on a portable device, is that a good idea?
Certainly not recommended from our standpoint. While there's nothing, you know, specifically wrong with it, what there's a great concern about is the opportunity to get a virus. Or other sort of malware that has automatically installed it. Now the patient probably doesn't know that this is on their system, otherwise they wouldn't give it to you, or has been recorded onto the DVD or CD. They probably just don't know. Where we become concerned is, and we've seen it happen, Mark, you'll remember a particular case where you know, people put in a USB with patient files on it, and all of a sudden their systems are infected, and now you've got a very big problem on which to handle. What we would do is encourage them to set up an account, send it through our system, because our system automatically virus checks every single image that's being uploaded, or every single document, so you'll never have that problem.
Right. Okay, so as I mentioned, we're pretty much at our time limit. There are a number of questions in the queue that we haven't had a chance to answer. So if I didn't mention it already, we will be sending out a link to a recording of today's webinar, probably sometime next week. In that, along with that, we'll include answers to all the questions that we were not able to get answered today. So I thank you very much for being so active and sending us so many questions. Unfortunately, you just gave us a couple too many, so we will get back to those. Again, I wanted to thank everyone for coming today and spending some time with us to learn about HIPAA compliance and secure mail and so on. And again, thanks to our friends at Dentamax for, so setting this all up. So Rohit, over to you for final words.
And thanks, Mark, and thank you to everybody for attending. You've got Mark's email address. You've certainly got my email address as well. It's Rohit, R-O-H-I-T, @brightsquid.com. Otherwise, you can contact @brightsquid.com, and someone from the team will be able to get back to you if you've got any specific questions or you'd like a demo set up for your office or whatever. Thanks again to the friendly folks at Dentamax for giving us this opportunity. Have a great weekend, everyone.